Tell me about operations on the nose.
Rhinoplasty nasal surgery, which is a common procedure done sometimes for function to help breathing, sometimes for appearance, and often for both, actually. It's an operation which is done by plastic surgeons who have training in the field, and it's an operation done also by ear, nose and throat surgeons who have training in the field. And other than turf disputes, actually, providing the person is properly trained and good, I don't think that there's any reason to say the one is better than the other. Some may have a slightly different focus to other people, but I think that field has opened up a lot over my professional lifetime. It's become a much, much more precise operation than it ever was 20 or 30 years ago. Rhinoplasty is a curious operation in that dissatisfaction, or the potential for dissatisfaction, is higher than with almost any other mainstream cosmetic procedure. I'm excluding some of the slightly more edgy things, but things that we would talk about. And nobody's ever quite figured out why that is. It was always said that if you asked any plastic surgeon anywhere in the world which patient group is most likely to be dissatisfied with the outcome of a cosmetic operation, the answer would be young male rhinoplasty. And there is a mnemonic, Simon, I won't bore you with what it means, which outlines that dissatisfied young male rhinoplasty patient. But I would say, and my colleagues who I speak to about these things would agree with me, that in the last, say, 10 years, young female rhinoplasty patients will not be far behind. And I can only assume that that has to do with social media and the like, and the pressures, peer pressures, that people are put under as a result. And certainly, these conversations to have with young people are quite difficult because one doesn't want to sound condescending and doesn't mean to be condescending in any sense. But I think it is very important, particularly with young people, that you do have a conversation that says, look, we can achieve this, we can't necessarily achieve that. This is realistic, this may not be. This may be the consequence if things don't go quite as you want them to, and the likelihood of that happening is X, Y, and Z. And then, of course, you have the morphing programs, as they're called now, 3D morphing programs, which all have a place, of course. But the question I get asked most often by patients in that regard is, can you show me what it will look like after, doctor? To which my answer is always no, because I don't have a crystal ball. On the other hand, I do have a morph program on the computer, and it is possible to change the shape of the nose on the computer, which can be helpful, again, in getting an idea of what's in the patient's mind, so long as you are agreed and understand that this is a kind of broad brush outline. It isn't predictive necessarily. And I saw a young lady patient not so very long ago, 20 odd, who I said, oh, we can morph the things on a computer. She said, oh, I've already done that. I've done it on my phone. And she had an app called, I don't know what it's called, plastic surgery or something. She'd done it on her phone. So my morph program cost me, I don't know, $1,000 or something. Her thing cost her £2.50. It seems to do much the same. But so rhinoplasty is a common operation, and now, as I said, very precise. I think our analysis is much more detailed than ever it used to be, and the popularization of open rhinoplasty, that's to say, not doing the whole thing from the inside, but making a little scar across here too, so that the surgeon can really see and has the opportunity not just to change the size of structures, but also to change their shape with stitches in a much more precise way, to use cartilage grafts stolen from inside the nose to support the tip, for instance, or to straighten it when it's wonky. The visibility is much more accurate now. So rhinoplasties sometimes are done only from the inside, that's known as endonasal rhinoplasty. Sometimes they're done using open rhinoplasty, mostly from the inside, but with a little scar here. Some surgeons only do open rhinoplasty. Some surgeons only do endonasal rhinoplasty. I think most of us do both, depending on the specific requirements of that individual, largely determined anatomically rather than by any other means. So when you have a conversation with somebody about the complications associated with rhinoplasty, it's not like most other operations, because if you were to talk about most cosmetic surgery procedures, there's a long list of potential complications, most of them very minor. Mostly the incidence is very rare, but nevertheless they're possible. With rhinoplasty, very few. So infection, incidence is about 1 in 1,000. Bleeding, I've readmitted, I think, 5 patients in the last 20 plus years bleeding after rhinoplasty, and only 2 of those needed another operation. So complications in that sense that we would usually use that word, rare. The most common complication of a rhinoplasty is the individual not getting the outcome they want, which isn't common, but it's well recognised, and it happens for 3 different reasons. It happens because there is a technical imperfection. Let's say there's a piece of cartilage that causes a little bump, depression, irregularity, and a small percentage of people who have a rhinoplasty, most would say between 5 and 10%, may need a second, usually very minor procedure, when all the swelling's gone down, to address a problem like that. If you turn the statistic round, of course the majority don't, but it does happen. You may have an unsatisfactory outcome because the surgeon and the patient didn't understand each other very well, which is why having a big image of the patient that you can look at together, that they can point at, that you can point at, is really helpful. And for the majority of rhinoplasty patients that I see, I'll see them more than once beforehand. And lastly, there is this very important issue of expectation, because if the expectation is unrealistic, doesn't matter what the outcome, the individual won't be happy. Which leads us on to a discussion about body dysmorphic disorder, which is perhaps the extreme end of that group of patients who essentially have an image of themselves which doesn't match with what everybody else is seeing. They have a focus on an aspect of their anatomy which occupies a space in their mind much greater than it does in reality.